incredibly important to be using it. The image space that you're going to try and hit is about 2 millimeters at the maximum. So 1 millimeter is the width of a credit card. So trying to go blindly into a skin without being able to see and get into a 2 millimeter spot can be very difficult.
Okay, so come a little bit, so right up underneath it. And stay at that angle. Stay at that angle.
Deep breath.
So stay at that sharper angle.
Oh, okay.
There it is. There it is. All the way over here, because we have shadowing of the PSIS, so your posterior superior iliac spine. We have some shadowing there, so we can't see it. So then when you are ready, go ahead and inject. A little bit of fluid, a little bit of tightness. Go ahead and put it all the way in there. Good. Should be free flowing. And we're done. There we go. Nice job. So right where that arrow is.
Ready?
Ready. You guys see the needle?
Yeah.
You're there. Okay, we're out. One down.